Right here, you're seeing an EKG of a patient who came in with chest pain. Patient was in their 60s, had left-sided chest pain that traveled to the shoulder, no jaw pain, no shortness of breath. Patient didn't see a physician and so was not on any medications, but had no history of coronary artery disease, PE, or any other significant illnesses. Patient was examined and this EKG was done. A repeat was done pretty much 10 minutes later, and based on the ST changes in V2 with the poor R wave progression, the ER doctor felt it was best to activate the Cath lab. However, when the cardiologist looked at both EKGs and heard the presentation, the cardiologist wasn't convinced enough to continue the activation, so requested that the Cath lab not be activated. However, a bedside ultrasound was done, which is seen here. You can see this is a combination of both the parasternal long view and also the parasternal short. When you take a look, you can see that the posterior wall here and lateral wall seems to be moving okay. However, the anterior wall really isn't moving as good as you would like. This is another attempt here of the parasternal short, and again, the anterior wall really isn't contracting like the posterior and lateral wall, and this is concerning for a wall motion abnormality. Again, here you can see the anterior wall not contracting, but the posterior and lateral walls are almost touching, and this is concerning for a wall motion abnormality, and thus an LAD territory infarct. One more clip was saved of the parasternal long, and if you are worried about an LAD infarct, that also does involve the apex, which you can see doesn't seem to be moving as well. This is from the ultrasound of the week. You can see as I'm scrolling through, there are a lot of videos that kind of illustrate a nice tutorial on which areas of the myocardium are related to which parts of the vessels. And this is a nice colored illustration of where the LAD territory supplies, the RCA, and the circumflex. And look here, again, based on this colorful image, you can see that this anterior wall here is supplied by the LAD. So look at this tutorial video here and compare it to the actual patient ultrasound, and I hope that it becomes more clear that not only is there indeed a wall motion abnormality in the anterior wall, but this does indeed correlate to a LAD territory infarct. And in fact, the patient did have a 99% occlusion in the LAD.